Hello and happy Valentine's Day. Thank you for joining us for this second event of the new calendar year. Welcome from me, Michael Scott in Oxford, and from my joint convener, Sanford J. Ungar in Washington, D.C., to the 16th jointly promoted event between the Future of the Humanities Project and the Free Speech Project. The latter is sponsored by Georgetown University and the former by Georgetown's Humanities Initiative in association with the Las Casas Institute for Human Dignity, Blackfriars Hall, Oxford. Together, the two projects consider issues concerning human dignity, rights, cultures, histories, traditions in a wide spectrum of educational activity, policy, expression, and aspiration. Now, if I sound a little croaky today, it's because we really like to be contemporary with these events. And I've gone and got myself a virus. I caught Omicron. But I'm here, and I can't pass it on through the means of the Zoom. So you'll be all right. In a moment, I'll hand over to Sandy, who is director of the Free Speech Project. He will introduce today's distinguished panel and moderate the ensuing discussion before I return to chair the question and answer session. From the start, you can type in questions to the panel by using the Q&A button at the bottom of your screen. These questions will come to me during the session, and I will try and put them to the panel to consider towards the end of the session. We urge you, please, to ask questions and to do so right from the start. Then I will try and put as many as possible to the panel. Please use the Q&A button, not the chat button. Thanks very much. I hope you enjoyed today's discussion. Over to you, Sandy.
Thank you very much, Mike. Appreciate your being here today, as usual. And it's a great pleasure to launch this discussion with some very distinguished panelists that we have recruited to participate. I'll introduce them briefly. John Cohen, a senior correspondent at Science Magazine, who has reported on many of these issues over the years. Paul Coleman, founder of the National HIV Story Trust in the United Kingdom, who has his own background about trying to spread responsible information and memory about a virus. Erin Garcia de Jesus, a staff writer for Science News here in Washington. Apoorva Mandavili, senior science and global health correspondent for the New York Times, and she is coming to us from New York. And Olwen Williams, vice president for Wales of the Royal College of Physicians, and a very distinguished physician indeed with a record on fighting viruses. I think the first thing we want to get at today is this question of why, in the context of so much success in recent years, and in that I would conclude the remarkably fast development of a new class of vaccines to fight COVID-19, why has it still taken so very long to deal with it? And why have we lost millions of people around the world and still counting? I wonder, Apoorva, if you want to take that overview.
First of all, thank you for including me. This is really looking forward to this discussion. I think that when people have thought about public health efforts to beat back viruses, politics has always played a role. And, that was true for HIV, that's been true for lots of other things, but I think we've seen it collide, the public health collide with politics in a way that we really have not before. It's at an unprecedented scale where, political leaders, the average citizen, everybody has an opinion on how we should deal with this virus. And I think that has really derailed all of our efforts to fight this virus and contain the epidemic. And that's been true not just in the United States, although we've talked a lot about that in this country. It's been true in many countries. And I think that's really sort of unexpected. And I don't think we were prepared for that.
Paul Coleman, in the UK, would you agree with what Apoorva just said, that politics have very much gotten in the way of a broad public understanding of the challenges we face?
Yeah, for sure it has. But I think, very much like with HIV, a lot of this is driven by human responses or the lack thereof. So I think you have to take both into consideration. I mean, certainly back in the days of the pandemic, our government here and in America and elsewhere in the world was very quiet. I didn't say very much at all, and it was left to individuals to, bring about some change and welfare for people who were affected. I think the difference this time round with COVID is that politics has got involved, and I think has confused many issues, because the type of information which has been generated is not always been very good.
John Cohen, do you think in the reporting there's been a strain of dissent that's arisen just recently? I've noticed in the last week or so, people saying, well, the public, things weren't well enough explained to the public, that this was somehow left to politics to be talked about, and that there are those pictures of viruses, but not enough common understanding of what the virus can do and what the consequences might be of not getting a vaccine.
So I think confusion always reigns supreme in outbreaks, and this one has magnified the confusion, and people want certainty when certainty doesn't exist. That's just human nature. And I agree about the politics. I also think that communities and cultures have behaved very differently in different parts of the world. If you look in much of Asia, the sense of community and behavior, it sort of transcends politics in some ways, because so many countries feel bonds with each other that the United States and parts of Europe, they just don't behave the same. And so mask wearing is, something that's been common in Asia for decades. And vaccine rates in lots of Asian countries and the restrictions they put on people, which some people in the United States or elsewhere look at as draconian, are accepted more readily in many countries. So I think that it's been a very confusing time, and this has allowed people who want to peddle disinformation to have a lot of opportunity, and they take advantage of the confusion, and they take advantage of the way, frankly, science works. And science is based on what you know, and you change your mind when you learn new things. And that very concept, I think, rankles people. I think it really upsets people that, a scientist changed her mind. Well, that's because she's a scientist.
Oh, and I notice you smile about that. It sounds familiar to you.
It certainly resonates, and it resonates the sort of cultural changes that we've seen and differences that we've seen even regionally within the UK around how our different governments.
Oh, and could you get closer to your microphone by any chance?
Right there, yeah.
That's better, thank you.
One of the things that we've seen in the UK is that we've actually had political differences between, the five nations as such. So with the different governments within the United Kingdom taking completely different stances to the epidemic, both now and from, when with the AIDS epidemic 40 years ago. So I think there are cultural changes that we have to take into consideration worldwide that has meant that we've all behaved very differently.
Erin, in your work you work for a publication that seeks to explain scientific issues for a more general popular audience than John's publication, for example. And so Science News, what are the challenges of trying to deal with this very complex pandemic, and where, as John says, confusion reigns, and trying to get information across so that it doesn't run into political obstacles?
I mean, I agree with a lot of what other people have said already, is that, confusion reigns in any outbreak. And I mean, there's a lot of information sometimes that you don't have at the time. I mean, science is a process, and it takes sometimes a long time, to figure out what the right thing to do is in a particular situation. And this pandemic has been happening under a microscope. Everybody is hyper-focused on every little thing. And so a lot of what we've tried to do is just kind of lean into that uncertainty and, be very frank with our readers of what we do know and what we don't know. What people are doing to figure out those answers. We're trying to navigate, what are people talking about now? What could we help explain? Like, where's the confusion? Where could we, find a foothold to help people better understand what's going on?
John, I know you've been critical of the anti-vaxxers and how they have come, at least in the United States, and I think in some other countries too. You read about now recently Canada, but in France and in some parts of the UK, I believe as well. The anti-vaxxers speak as if they have equal authority with the scientists and the politicians who favor draconian measures. I have a couple questions in this area, but I wonder how, if you, with your own experience, have some thought about how this could have been or could still be handled differently.
Well, for one thing, there is certainty about the safety and effectiveness of vaccines in adults. That's perfectly clear. They work. And we don't need any more data to show that vaccines keep people out of the hospital and prevent deaths in adults. It gets more complicated as you get younger and younger. But the thing about vaccine hesitancy is it's not the same as being anti-vaccine. And there's a tremendous amount of hesitancy of people who end up getting vaccinated. A high proportion of hesitant people end up getting vaccinated. I think we're in an ironic moment with this trucker convoy where 90% of them are vaccinated. The mandates already have worked. So people screaming their heads off now about mandates, well, for the most part, they've done their job. We have incredibly high adult vaccination rates in countries that have had access and have staggered access to the most vulnerable groups. So in the highest age bracket, over 80, the vaccination rates in the United States are extraordinarily high. And we've never had an adult immunization campaign that's been this aggressive or this successful. So I think there's a lot of confusion about what anti-vaccine means. Anti-vaccine means people who will not be vaccinated under any circumstances, regardless of any data you give to them. And that's a very small percentage of people. And for those people, I think people have always made bad health decisions. There are smokers, they know that smoking is harmful and they choose to smoke. And there are people who make smart health decisions. And at some point, and I think we're at that breaking point, there are people who make smart health decisions and there are people who make bad health decisions. And the real question is, are they affecting the community? Are they making the healthcare system collapse because of their bad health decisions? That's why we went into lockdown. We wanted to keep our hospitals running. That was the whole idea of flattening the curve. And vaccines largely have accomplished that everywhere they've been accessible. There's a huge problem with equity and vaccine inavailability or access in parts of the world. But in the United States and Europe and many of the more developed, wealthier countries, access isn't the issue. And so I think it's a complex ball of wax, and the mistake we make is boiling everything down to anti-vaccine. That's not what it is. Hesitancy is a very different beast, and it is confronted with very different tools. So
are there reasonable grounds for hesitancy, Apoorva?
I think so. I mean, I agree with John that the actual number of people who are, virulently anti-vax is actually very small. I think there are a lot of people who have been fed the wrong information and who, are hesitant for various reasons. They think this is new. They think mRNA is untested. They think it's unsafe and they're being lied to. There are, reasons that we may not agree with, but they are legitimate from these people's perspective. And I think it's, important to remember that not everybody has the access to education and to science education in particular that we've all had. And, it can be very confusing when you are someone who doesn't understand how all of this works. One thing I think that the public health community did not do well in this pandemic is get ahead of the wrong messages. I did some reporting in Rhode Island last year in January, before the vaccines were really being rolled out. And there were some immigrant communities there that had already been fed so much wrong information through Facebook and, you know, other social media. And I think that was just a real lack of foresight by the public health community and by the government to wait until after the vaccines were rolled out to start talking about them. I mean, the anti-vax community is extremely organized and their messages are very simple, whereas science is always complicated. So if you are somebody who, you know, needs a quick answer, where are you going to turn? And I think we really missed a lot of opportunities to get to people early and to package the information in, you know, clear, simple ways.
You know, my day-to-day business is fighting for free speech and documenting challenges to free speech. And so once in a while, someone says to me, look at the harm that free speech has done. Look at the challenge to the public interest presented by free speech. And I have, you know, I've wondered whether this growth of the anti-vax community, even if it's in real numbers relatively small, and the growth of this disinformation is an unfortunate cost of free speech, that people telling foolish things and untrue things to their neighbors, to the public, are perfectly entitled and indeed were facilitated by social media in the early times. It's been good for the business of social media to promote such misinformation, disinformation. And it's hard. I mean, I think it's hard to accept that people use their liberty to protect themselves and to speak openly, potentially to harm others. I don't know who wants to take that.
I mean, I would say that's a really slippery slope, right? We've tried to do that before. We've tried to have ways of curtailing free speech or thinking about it. And it just, like, where do you draw the line? Where is the line between somebody who is genuinely confused and is trying to, you know, ask questions and spread something that they believe? And how do you know that they are actually, you know, ill-intentioned? So I think it's just a very difficult line to adjudicate. I don't know that we can really go down that road.
Yeah. And what I'd like to come in on this one as well is the issue of getting the message right. And we talked earlier about science changing so quickly with you know, COVID throughout over the first few months, that actually what message were you getting out there? And then when the vaccines were coming on board, you know, who do we target? You know, do we target the older people who of course don't tend to use social media as much, but also missing out on targeting some you know, a big group, which were the women that were aiming to get pregnant or who were pregnant in the UK. I mean, they were really reluctant to get vaccinated. And I must admit, even in my own family, I had to go and have the conversation with the 20-year-olds who were saying, oh no, we're not going to get vaccinated because we're trying for a family. And I was going, whoa, actually, you need it more than anyone at this point, because, you know, there was lots of stuff amongst quite intelligent people, misinformation about the harm that vaccine might have on the unborn child. So, you know, and I think sometimes we didn't know what the science was, but actually we had to assume that getting COVID while you're pregnant is much worse than having a vaccine while you're pregnant. And, you know, that weighing up of risk that you have to do. And, you know, there is a place that public health has to play in saying this risk is higher than that risk. There might still be a small risk, but you've got to balance that up. And that message, I think, was a really hard one to get out as, you know, the information was changing.
I think it's also, Sandy, that free speech has always come at a cost. This is nothing new.
Of course.
And the vaccine movement is nothing new. The anti-vaccine movement is nothing new. It dates back to the first vaccine in Edward Jenner and the English uprising with the Luddites, who opposed mandatory vaccination. So it cycles through human populations. The notion, because people have a very poor understanding in general of risk versus benefit, and they don't recognize that doing nothing puts you at risk And when you compare doing nothing with the vaccine to the risk of the vaccine, it's overwhelmingly clear that the vaccine presents a lower risk. But people don't gauge things. There's an old saw about lung cancer. 90% of people who get lung cancer smoke, but 90% of people who smoke don't get lung cancer. So you can smoke and say, well, 90% of people don't get lung cancer. Okay, but that's the same sort of risk-benefit analysis that I think is really hard for many people to grasp. And I think that's what's at the core of the confusion is the understanding of risk versus benefit.
I think another hard
Go
thing
ahead,
is
Erin.
that
Yes.
we're viewing this now in hindsight, thinking about, we know how effective these vaccines were, and they outperformed any of our wildest dreams in the very early days. We were all, very surprised to find that they were so efficacious. And they happen to be these new technologies. I mean, back in 2020, when we were still going through trying to, following the development of all of these vaccines, we didn't know what was going to work. We didn't know whether we were even going to have a vaccine at this point, much less how effective it might be. And so I think, trying to navigate that uncertainty on top of, okay, how do we talk to people about efficacy? How do we talk to people about these new technologies that was really difficult. And, hopefully going forward, we'll be able to tackle a lot of these issues in future outbreaks.
Paul.
I want to add to something that Erin said right there, which I think is one of the things that I meant when I said that we didn't, we lost some opportunities along the way, which is, we know, the people who've been reporting on science know that mRNA technology is not brand new, that there's been lots of work behind the scenes. And I think that we didn't do, when I say we, I mean, not just journalists, but the public health community also did not do a good job of talking about that technology as not new, as, sort of laying the groundwork for, you're going to hear about these vaccines and they're going to sound like they're based on this very new technology, but there's been a lot of work. And, I wrote a piece last year talking about how, the CDC and the FDA could have done these like 2-minute videos explaining things throughout. And we didn't do any of that kind of thing. I mean, John was talking about, Asian communities being much better about public health. I think in this country, like, we just don't think about public health. We don't think about what I do affects other people. And that's an ongoing education. It can't just start in the middle of a pandemic.
Yeah, and I think that's part of the point that I was alluding to earlier, that people are saying, well, you didn't tell us enough. You didn't explain enough about the dangers, the process, et cetera. I want to turn to Paul Coleman, who has done what I'm told is remarkable work in the UK at documenting the fight against HIV over a period of time. And I wondered, Paul, what lessons you think there are to be learned from that?
Well, just picking up on what the others have been saying there, it sort of all resonates very much going back to the last 40 years when HIV sort of first crept onto our shores. And I think we were at a disadvantage then in that we didn't know how transmission was carried out. And society decided to marginalize the people most affected by HIV, which is, of course, the gay community. And interestingly, with COVID, although we haven't identified a small group, what we did do right at the start was say, oh, it's in China, it's the Chinese, it's because they eat strange things, or some particularly odd sort of ideas about what people do in their own countries. So we say it's other, it's over there, it's away from us, we don't need to worry. So we're losing, in this case, really valuable time because everyone's thinking it's elsewhere. Of course, it's not elsewhere, it's everywhere. And, again, back in the day with HIV, the gay community in the UK started saying that it was the gay community in San Francisco in bathhouses who had this strange cancer, which we now know to be Kaposi sarcoma. But we had this idea that it wasn't a threat to us. And I think in the very early stages, certainly in governments even, they were turning to and pointing at other countries. We were seeing it was terrible in Italy and places like that. And it wasn't going to come to us somehow. It wasn't going to affect us somehow. And even when it did affect us in this country, in the UK, I had discussions with people saying, oh no, it's all happening up north, it's fine down south. And viruses don't work like that. They don't hold in one community or one place. They spread, that's what they're there. to do. That's why they've come into existence. So I think what you have to do in those very early days, picking up from what people were saying before, is the educational part to it. With HIV, we waited, I think, till about 86, 87 in this country, before our government came forward with the Don't Die of Ignorance campaign. And it was hugely successful. I mean, many thousands of people didn't die because of that campaign. Unfortunately, what it did do on the downside was stigmatize the virus. And we're still fighting that stigma, because they used a campaign that was scary. It was voiced by John Hurt, who'd just done Alien, gloomy and doomy narrative with tombstones falling down and flowers going down on gravesides. It was very scary stuff. And therefore we sort of demonized the virus, and then demonized that community who was on the end of it in those early stages. So education is really important, but it's got to be the right education too. And we have to think about that. I was absolutely blown away in the UK that there was nothing, there were no adverts on TV. If you went back to 86, 87, when the AIDS virus was spreading, every other break in a show had that advert in. Okay, it came late, 7 years after many thousands of people had died, but it did come. And I thought that in this country, certainly, we would be doing that with a really centralized campaign, so that people could understand what was happening and how they would look after themselves and their loved ones. And we just didn't do it. We didn't learn from the past.
Are we learning now? Are we learning better this time in some fashion, not to make those mistakes? I know almost everyone I know just can't figure out when to think it's safe to do X, Y, Z, or Q. Should we take airplanes? Should we go to see movies in cinemas? I mean, these are just minor things. How much do we mix with other people? How careful do we have to be? What is there some consensus route that we've found? I haven't seen it.
I think one of the challenges we've got at the moment is actually what our leaders are telling us versus our own personal beliefs on what is the thing that we do. So a lot of people will actually go against what the advice is. So they'll be told it's all right not to wear masks, but will continue to wear masks. And there will be a huge strand of the population that will be very careful because they're not quite sure of the information they've been given and been told that it is okay to do stuff. And I think that's going to be interesting. The public, certainly in the UK, will make some decisions which will go against what they're told that's safe to do.
I think we have some lessons from HIV too, though, that what happened with HIV was there was a denialist movement that is analogous to anti-vaccine or a vaccine hesitant movement of people who didn't believe the virus caused the disease. It grew very large internationally. And the president of South Africa, the hardest hit country by absolute numbers of infections, embraced the idea. And so politics became mixed up in it. And I like to look back at it and ask what happened. Why did that movement go away? And one thing that happened is effective antiretroviral drugs became available. And when they became available and people had access in different countries, those denialist movements faded. And it was all about access to working medicine. And over time, I think the vaccines are going to conclusively show people that they keep the hospital systems running. They don't prevent infection. That's a mistake that we bought into early on because the clinical trials with 95% efficacy were about mild disease. They weren't even looking at severe disease, hospitalization, and death. And so we all became confused. And I think there was this mass expectation of protection from infectivity that set us up for a lot of misunderstanding about what vaccines do. And I think masks over time will have a similar impact where we will see the hospital systems functioning and not collapsing, and masks will fade away. And I live in California. where they're lifting the mask mandate now. And I went shopping last night and 50% of the people in the supermarket have masks on. It's already fading. And we're also playing the accordion. We will open it up and close down over time as need be. If there's a new variant that suddenly starts overwhelming our hospital systems, overwhelming our vaccines, masks will come back in full force, social distancing will be ramped up again. And we have to be prepared for that flexible behavior. And that's what happened with HIV everywhere. You had to respond to what was happening in your community to have an effective response.
I completely agree with that. I think we need a framework to think about when do we put the all of the cautions back in, and when do we ease them, and that is something that we really did not do throughout this pandemic, and I think has to be figured out before the next one, because what a lot of leaders did during this pandemic was say either everything is great or everything is terrible and we have to completely go into lockdown, and there was no middle ground. There was no we're heading towards something good, we'll be able to maybe take off masks, but then we may have to put them back on. It was just not, they just didn't tell the truth a lot of the time. The idea when the CDC said you could take masks off in May. I mean, every infectious disease expert I knew, every respiratory disease expert I knew was shaking their head like, why would they say that? We know that the virus can spread asymptomatically. We know that vaccination is not going to stop people from getting infected or spreading the virus. So why would the CDC say that? And I think that kind of confusing message leaves people feeling lied to. So we need, a sort of clearer framework where people feel like they're getting the truth, and they may still, as Owen said, they may still decide not to follow that advice, but at least to have the CDC says, this number of cases in your county means it's no longer safe to go, and this is, this number means you can now start to relax. So some sort of number to wrap your head around instead of just it's safe, it's not safe.
Have you figured out the answer to your own question, why the CDC handled it so badly?
I think that, the CDC came into the pandemic, with the Trump administration really meddling, and there was so much confusion then. They muddled so many things, just there was some incompetence, there was some confusion, they made a bunch of mistakes. And I think when they came out of the Trump administration, that the morale was so low and they had such bad press everywhere. I think they felt unable to really move quickly. That's something that's plagued the CDC throughout. They're just not good at jumping quickly and making decisions, especially making decisions on bad evidence or limited evidence, and being able to say, this is all we know. They're just not good at that. They want to be sure before they say something, and that's just not something they can do in a pandemic like this. So I've been speaking actually to some people who said maybe the CDC should continue to do what the CDC does, which is be very slow and plodding. Maybe what we actually need is something entirely separate, just to be really nimble and quick in a situation like this, so that we have two separate functions, one that's very slow and careful and one that is really fast and responsive.
Paul, you were going to say something.
Yes, I was, and it's almost left me now. I think what I was going to say is that we're in this for the long run. I think people have this sort of idea that maybe next year with COVID and its variants, we'll sort of be okay and we'll all be back to normal. And we're clearly not going to be. No one can predict the future, but our behaviours, we must take those into account going forward for quite a long time. I mean, if you look at with HIV, 40 years of HIV, there's very good treatments for people with HIV now, and they've made amazing progress in the treatment around people with HIV. But that is ongoing. There's still large parts of the world who don't have access to those drugs, and they're trying to make that happen. But it's not an easy thing to do. So there are 36,000 people who've died of AIDS. There's 37 million people around the world living with HIV, and nearly 1,770,000 or something people dying every year from AIDS. So, 40 years on, we're still fighting that battle. And I think you've got to sort of start to look at these pandemics, COVID included, in a much more wider context than just the moment, and building some infrastructure to follow it up. We still, large parts of the world haven't got any access to the vaccine. They've got to get it. We've got to galvanize people to take this forward, not just think it's over.
So taking the long view and looking into the future, what are the prospects for dealing with the next pandemic or with other harmful viruses? Does anyone emerge from this with relative confidence or a dab of optimism about the future? The silence is.
No, I think we're getting very slowly, we're getting better at things, but it all comes down to a sense of urgency. And we had a sense of urgency about making COVID vaccines and drugs and tests. We haven't talked about the drugs at all. The drugs are going to shape things too for the future, because they will again reduce severe disease and death. But I think what's going to happen over time for the next pandemic is we're going to look more broadly at protection. And so we see increased discussions and research efforts at making pan vaccines that cover far more than just the variants to SARS-CoV-2. Let's get a SARS vaccine that covers all SARS-related viruses, that whole family. That's very doable. But where is the sense of urgency to do that? There is no Operation Warp Speed to do that. There is no Chinese government throwing billions of dollars. Chinese government made half the vaccine doses used in the world. Let's not forget that. They threw a tremendous amount of money at it. And we, I think, need to keep this sense of urgency rolling right now to prevent the next one. And I don't see that happening. And that to me is the real challenge.
I think that's very difficult and politically very difficult to keep the sense of urgency, because the political advantage seems to be with saying, we're okay now, let's get back to
but Sandy,
normal life.
We respond to crisis. We don't do prevention. That's the problem. It's risk benefit, right? We have a law that makes people wear seatbelts, right? Why? It's ridiculous. Seatbelts work, but we just don't do prevention well, and we're much better at responding to a crisis.
And I think the other thing that this pandemic has really flagged up is the health inequalities. Certainly both, if you look back around globally around HIV and with this pandemic, the people that have died have been the people that have had the worst health and the worst conditions and not had access to care, rather than those in a different situation. So it's prevention in two, as regards having the tools to prevent, but also to improve the social determinants of health, which we are now talking about as being as important as the disease.
Right. Erin, before you were a journalist, you were a virologist. And so I want to ask you a question that may seem very simplistic, but all of this gives viruses a very bad name. I mean, nobody wants to invite a virus into their homes. But are there good viruses? Are there viruses that eat other viruses, that eat bacteria? Are there viruses we should be, cheering for somewhere on the sidelines?
I mean, really, what a virus is all in the context of what the host thinks about it, right? Like, we may think about coronaviruses and all these, retroviruses, like include HIV, like we think of them as really, really bad, right? Because for us, they are very bad news, but bats are a reservoir for coronaviruses. We don't know why they have all of these viruses. Maybe they do something good for the bat, or maybe they don't do something good for the bat. There are lots of viruses that target bacteria, and for the bacteria, that virus is bad news. But for us, that could mean that we can potentially use that virus as a therapy to treat bacterial infections that are resistant to antibiotics. And even, if you think about it, I studied the evolution of viruses. So like thinking really, really far back, like millions of years ago, these viruses that are bad news sometimes have the ability to change evolution. Like if you think about the placenta, the reason the placenta exists is in part because of a virus that incorporated itself and changed how an animal worked. I mean, we
That's a
think
big
about
one.
these, yeah, exactly, right? Like we think about these things in very short-term impacts of this is horrible, and viruses can have these huge effects on society and are horrible things, but there are viruses out there that give us a little bit of hope, and that, you know, make us think that not all viruses are bad for people.
Anyone else have anything to add on that? I mean, viruses have a pretty bad image, so.
Well, I just recently did a story about these pig coronaviruses, and there was one that acronym is TGEV that was devastating the porcine, the pig industry around the world. And TGEV went away in part because of a variant that emerged that was didn't cause severe disease and immunized all the pigs against TGEV. So it's a good virus. And live vaccines for viral diseases are good viruses that don't cause disease, but teach your immune system how to fight off the real one. So in the evolution of viruses and in the viral space, there are viruses that help us and protect us from viruses that harm us. So that's natural.
You know,
Yeah,
and
another example is you think about like the chickenpox vaccine, right? Like
yes,
that virus protects us from getting chickenpox, right? And I mean, I don't think, I'm trying to remember now, I don't think the virus that's actually included is, or maybe I'm thinking smallpox, vaccinia virus in the vaccine, like protected us from a disease that it's not specifically that disease, but it gives us immunity against it.
and there are examples, I think it's important to remember, of worldwide cooperation. I think of the polio campaign around the world, and a private organization, Rotary International, which doesn't get much credit for it, has done a huge amount in the worldwide fight against polio. When I worked at the Voice of America, we were in partnership with Rotary and in trying to spread the word about polio and about vaccines and the struggle against it. Why can't we reproduce those good international efforts these days? Is it because of social media, perhaps?
We're also talking about different scales of time here. It took us a long time to get to that point with polio. And even now, you know,
Good
we're
point.
close to eradication, but, you know, there's still 2 countries where polio is endemic. And part of the reason it is endemic there is because of vaccine resistance. Again, so, I mean, some of that is just you can't get to the families that need the vaccines, but some of it is that, you know, there is legitimate mistrust of the vaccines. And so I think we've done actually reasonably well. We haven't done well enough for what we needed, but we have actually done reasonably well when you think about the fact that we didn't even know this virus existed until 2 years ago. And all of a sudden, you know, we have a vaccine that works, and we've vaccinated 70% of, you know, many countries' population. So that's the glass half full side of it.
That's a good point.
Polio also is easier to prevent paralytic disease with a lower level of coverage of vaccination. So our challenge here is staggering. And I agree wholeheartedly with Apoorva that this is remarkable what we've done in a short period of time. And Rotary has contributed a tremendous amount to polio eradication, but it persists. And polio has a great advantage over SARS-CoV-2 in that there's no reservoir in the animal kingdom outside of humans. And we now have SARS-CoV-2 everywhere that's going to be ping-ponging back here. We're not going to eradicate this. Get over it. It's going to be here, and we're going to have to live with it. And we're going to have to find, as we have with influenza, a point where we can tolerate it. And right now, I think we're in a hopeful moment where we are moving toward the world tolerating this virus. And we need more vaccination. We need better and more available drugs. But we're approaching the toleration point. And that toleration point will be, once again, when our hospital systems can handle the burden of the disease.
Before we go back to Mike Scott to address the questions that have come in from participants, often from around the world in these programs, the word endemic has come up. And do we have to accept that COVID-19 for at least some period, that we cannot eradicate it, and that it is going to be endemic, and that we have to figure out ways, at least in certain places, that we have to figure out ways to live with it? Owen? You're muted, Owen, I'm sorry.
Oh, I think we've learned to live with a lot of diseases, infectious diseases over the years, influenza being the main one. I think the challenge is coming back to us is, do we have capacity and the desire to get repeat vaccinations every year? That will be our biggest challenge, and making sure that people do pick up vaccines, and the cost of that worldwide as well. So,
any other thoughts on that, Apoorva?
I mean, as John said, I think it's clear that we're not going to be rid of this virus anytime soon. It is going to be endemic. I think the problem actually that we're facing is educating people about what endemic means. There's a couple of different points of confusion. One is that when the virus ebbs, that we're endemic. Like, people are actually talking about the virus as if it already is endemic, and that's not yet the case. We're still pretty much in pandemic mode. But also, I think people have this false impression that endemic means we're going to have very, very few cases. That's also not true, because as we just mentioned, polio, TB is endemic in a lot of places, measles is endemic in a lot of places. That does not mean that there are very few cases. It just means that the virus has sort of figured out a way to exist at low levels all of the time, but that it does spike often and cause big outbreaks. So, you know, I think we have to come up with a plan to live with the virus that doesn't just involve having it be, you know, this very low level of infection, which I think is what a lot of people think endemic means.
Well, I time to go back to Mike and the questions that have come in.
Thanks very much. There's a kind of a worry, I think, coming through from a number of people about the politics issue. Rosmi Ghali says in the UK, the Prime Minister and his supporters have claimed that he is responsible for the success of the vaccination program. Do you agree, or do you not think that the National Health Service is the real hero? Perhaps, Alwyn, you'd like to start with that one.
Oh, yes, I think the NHS and how we moved, you know, CN Mountain to actually set up these massive vaccination programs has been a true feat of, you know, to be admired. I think probably word of mouth and the impact that people saw from the first wave of being vaccinated had probably more of an impact than what our Prime Minister had. I think also we kind of tiered our vaccination program. I think there were 6 tiers, which started with our eldest in the population, which probably gave everyone a little bit more reassurance, because for a long time our elders have been, you know, literally incarcerated at home until they were vaccinated. But certainly don't think it was the Prime Minister.
Okay, can I go on to another one in relation to that? In a sense, there is a lot of media discussion about fake news on both sides of the Atlantic. Politicians have talked about news and fake news, so that you've got that into the dialogue, into the conversation of people. And do you think, the question asked, do you think many people are skeptical about scientific views because we got into a culture of news and fake news? Who wants to take that? John? Cohen?
I mean, it's accentuated, but it's nothing new. I mean, the yellow journalism of the 1900s was filled with charlatans peddling snake oil. We've been confronting people with bad health information since health was a thing. It goes back to cobbling into stones. People have given people stupid information about health. And many religions peddled ridiculous ideas about health and had them in scriptures. I don't see it as new. I do see it as louder than ever before and makes it more difficult for people to navigate and to find who to filter for them and how to trust the information they get. And so it is more challenging in that sense. But I think we exaggerate like fake news, like it just, oh, this new thing surfaced. It's nothing new. And we've always had to wrestle with good and bad information, and smarter people find good information. It's just what has always happened in the history of humans. And I think the challenge is accentuated, but I don't think it's new.
I
Paul
think we
Coleman,
have always had.
Sorry, Prova. Yes.
Sorry, I was just going to say we have always had fake news, but I think what's new actually is that we have not had political leaders talk about journalists in these terms for as long as they did in this climate. You know, we came into this pandemic with the country already sort of divided. That's true, at least in the United States. You know, people already mistrusting the media, being told that journalism was the enemy of the people, that the journalists were actively lying to them, and that they were manufacturing fake news. I think that really has happened at an unprecedented scale. And so coming into that, you know, we are already facing an uphill battle on getting good information out there. And I do want to say that I don't think it's just that smart people find good information. I think that people don't get to good information for lots of reasons, many of which are not their fault, and including nothing related to their intelligence.
Paul, do you think in relation to the story of HIV that there was fake news or lack of news, or?
It's slightly different, actually. I mean, it was, you know, for some people, it was gay men deserved it. In the early years, gay men deserved it. It was the wrath of God. You know, it was unnatural acts. And a lot of that was peddled about. But as we've said, you know, there was no social media to spread news around. There were various gay papers that were very responsible about disseminating information about HIV and AIDS. And of course, what was really important in the early years was community. You know, there was gay men going out into the community, going into pubs and clubs, and along with lesbians as well, to leave leaflets everywhere. You know, when the pandemic was raging, up until around 95, any of the pubs and clubs that you would go into literally had leaflets all over the walls, all over the tables. There were free condoms everywhere in baskets on the bar and on the. So we were looking after our own, and we were trying to give them as much information as we had as we got it, and find the good from the bad. So yeah, I mean, the newspapers did spread stuff, and just generally just nasty. You know, it was just a good story because they could say horrible things about gay men. So yeah, very different now.
There was a lot of misinformation about HIV, and I covered it in real time. There was a tremendous amount of attempts to sell fake cures, fake treatments. Those were pushed very hard. There was a lot of debate about origin, just as there is today, that peddled information that was absurd about the origin being from military bases and things like that. And there was a lot of misinformation in the media, including the gay media too. There was a lot of bad information about HIV, and in some countries it led to really scandalous things. In South Africa, with a dry cleaning solvent being sold as a treatment. I mean, there were really horrible things that happened because of bad information and desperation early on in HIV. And we also had governments like the US government, Ronald Reagan, not saying the word AIDS, and creating a deception about it being a gay disease when it's largely a heterosexual disease. I mean, 80% of the people in the world who are living with HIV became infected through heterosexual sex. So there's all these mythologies that built up around bad information and HIV that I remember battling in real time. It's different now, it's louder now, and everybody cares about COVID. Not everybody cares about HIV/AIDS. Everywhere in the world is worried about SARS-CoV-2 in a way that the world has never shared a worry about a virus. in our lifetimes. And that, I think, has amplified everything because the worry is international.
Olwyn, what John was saying, I mean, you're a consultant in sexual health, and was, I think, a consultant in sexual health at the time of the AIDS epidemic, or if we call it that.
You're making me
what was your feeling about it?
So I qualified in '83, so right at the time when things were becoming quite difficult in the UK. I think what we've seen is some of the myths that started off from the early '80s continue, and while Paul was telling us that within, that the LGBTQI community, there's been ongoing information. There's also been a whole generation of people ongoing who've sort of kept on the sort of issues around how you acquire HIV and some of the myths about it, which are unbelievable that that's still happening in the 21st century. But I think the big difference between what we've seen in this pandemic and with the AIDS pandemic was social media. And, we might have been in a very different place with HIV if we had the same sort of social media as we've got now. But I do think there's a generation that still have some odd beliefs.
Thank you. Let me go back to Linda Sassi-Thedeth. I hope I pronounced that correctly, Linda. I apologize if I haven't. I believe, she says, I believe the anti-vax population is actually a lot bigger than we believe and is growing rapidly. How do you recommend we respond to those we engage in conversation who are adamant about statements like vaccines don't work because people are still getting the virus with them? Why won't the FDA give credit to alternative medicine? Well, before I ask anybody, I'll just say, I've had 3 vaccines, my 2 vaccines and my booster. I've got Omicron, and I'm really pleased I had the 2 vaccines and the booster, because it isn't very pleasant when you get it after you've got that. But it's not serious, That's how I feel about it. But that's Linda's view on that. Erin, what do you think about this anti-vax population? A lot bigger than we imagine.
I mean, it's tough, right? Because a lot of this misinformation, you don't want to amplify it. You don't want to, if you don't want to give it too much credence, right? And so, I mean, one thing is to, like, for instance, you just mentioned that, you're boosted, you've had your 3 vaccines and you still got sick, but there's a lot of people who say, like, that's evidence that the vaccines aren't working. And I don't think we can get in a time machine and go back and help with the communication of what the goal of vaccines were. I remember in 2020, we were reporting that, like, here's how we think about efficacy and here's the goal of vaccines. And, in some story buried somewhere is saying, like, the vaccines are designed to prevent severe disease and hospitalization. And that's what the FDA was looking for. And there's a lot of reasons why that was the case. This is a respiratory virus, which John mentioned earlier. Like, it's hard to prevent infection from a respiratory virus because your nose is exposed to the elements, your mouth is exposed to the elements, you have things coming in at all times. Like, these are the areas where your immune system is working to protect you, but they're going to get infected at some point from something. The question is whether you have symptoms or not, or whether you get really sick or not. Sometimes I think amplifying that message is useful. But I don't know that explicitly is going to change anybody's mind by itself.
Anybody else want to come in on that?
Well, we know from history that people change their minds about vaccination based on experiences and not based on facts. And Michigan had a very interesting law change in 2014. If you wanted your child to get out of a school vaccination requirement, for the waiver process, you no longer could go to your doctor. You had to go to a public health official for a 30-minute meeting. And the next year, the waiver request dropped 40%, and hardly anyone went to the meeting. And the people who did show up virtually didn't change their minds at all. So the obstacle created the hurdle that got people over the hesitancy they had. They said, parents said, I'm not going to go downtown and listen to some fool talk to me for 30 minutes, pay for parking. I'm just going to vaccinate my kid. So their hesitancy wasn't that strong. And as we see obstacles building, and we have seen obstacles building with vaccine requirements to come into restaurants or to get on an airplane or whatever it is, more and more hesitant people, I think, are going to decide to hell with it. I don't want to fight this any longer. And it's not because they're going to suddenly learn a fact that 91% of the people in the hospital who died were unvaccinated. They know that already. I don't believe that information hasn't reached people. I think by and large, people who are hesitant about vaccination understand the facts, but they worry about a long list of other things that go against those facts. And they think, well, I'm not that vulnerable. This isn't speaking to me. And if you look at the over 80 bracket everywhere, you see the vaccination rates are extraordinarily high because the over 80s don't have that risk benefit dilemma that somebody who's 30 years old or 20 years old has.
Understood. Angela Preston often sends in really good questions, and she has again today because she refers us to the historian John Barry's study of the Spanish flu, which killed an estimate of 50 to 100 million worldwide. And that's a bit close to my history as well, because my grandfather died in the Spanish flu. That's why I never met him. And she says, she quotes from Barry, says, those in authority must retain the public's trust. The way to do that is to distort nothing, to put the best face on nothing, to try to manipulate no one. And then Angela asks, have we evolved as a society 100 years later? Well, I might add that the Spanish flu came on the back of the First World War, and at the moment we've got our major powers facing each other in the Ukraine, but perhaps that takes us off the subject. But she is asking, have we evolved as a society 100 years later? Apoorva, what do you think about that?
I think you know what I think about that. I don't think we have. I think we actually have had leaders say they're the worst about something or the best about something. Like, let's take masks, for example. At the beginning of the pandemic, they said masks don't work at all because they were worried about healthcare personnel needing N95s and having a run on those masks. But then when they did start talking about masks, it was masks are wonderful. And I think what would have actually worked better is to say, we don't actually have any studies showing that masks work, especially for this virus, but we think that it will do some good. And we think this is sort of the order in which it might do some good. I think more people would have been willing to trust what they were hearing if they'd had those caveats in from the beginning, instead of being told, one thing and then the other. That the reason we hear so often that there's all this flip-flopping or this change of opinion is because there has been publicly. And I think that having that uncertainty baked in right from the start would have been different. We did know in November 2020, I was writing stories in December 2020 about how people who get vaccinated will probably get infected. And this is why you should continue to wear a mask. But we weren't hearing that from the CDC. We weren't hearing that from public health community saying, you know what, keep wearing those. I mean, some public health experts, obviously, the ones I was talking to, but overall, we were not hearing those things. And I think that impulse to put the best face on it, I understand where it comes from. People needed a carrot, people needed some way to relax, some way to sort of think that lives were going to get back to normal eventually. But I think in trying to give people that reassurance, they went too far. And I don't know that we've actually still learned that lesson, because I still see it happening.
Thank you. A question, another interesting question coming in from Young Hachalima. Again, I apologize if I haven't got that the surname correctly. Who says, from an African setup where I come from, misinformation about the choice and the type of vaccine one has to take has been a great hindrance, and mostly influenced by non-legit reporting platforms on social media. More so, health promotion at the onset was only limited to government and private firms, and not much was done with religious leaders where the majority of people meet. Well, there's quite a bit in that, but this misinformation in relation to the type of vaccine. Olwyn, would you like to talk about that one?
Yes, I think there was quite a lot of confusion about efficacy of the vaccines, of which one to use with which group of people right from the beginning. But I think that's sort of sorted itself out now. I'm not sure if the other panelists would actually agree with me on that one. But going on to what he was saying around religious leaders, I think it's important that all people are engaged, all people that can influence are engaged in giving the right and correct messages out. And in some communities, religious leaders are the best sometimes of actually giving that information.
Yeah.
Thinking when John was talking about people not being swayed by facts, that it matters where the facts come from. I think he's right. Most of the time people are not swayed by that, but there's also all different kinds of vaccine hesitancy. And depending on whom you're talking to, you might need that to come from a different kind of trusted person, like a religious leader or a community leader or somebody from, you know, their own community in terms of race or ethnicity. Whatever the case may be, you know, everybody's hesitation is different. And I think it's really important to figure out, why are they hesitant to get it? Is it because they're afraid? Is it because they have, you know, some reason to mistrust what they're hearing? Or is it because they just want to wait? You know, they're just late adopters. There's different ways of talking to all of those people. And I think, yeah, as Owen said, it's so important to figure out who those people are and to engage all of them.
I understand why there's confusion about the different vaccines. There are 24 vaccines by my last count being used around the world, and they have different efficacies and they work better and worse against different variants. So there's a lot to consider. The gold standard that I think you can use is looking at the World Health Organization's emergency use listing, which is a process to basically regulate which vaccines meet their standards. And so that's one way to gauge. COVAX is an international attempt to get vaccines to everyone in the world, regardless of income levels. And COVAX uses the WHO emergency use listing as the bar you have to cross to. And some of the vaccines that have performed poorly compared to the other vaccines are still pretty good. So if that's all you can access, it may well be far better than not getting vaccinated, and you can build on whatever you start with. So you can get a mediocre vaccine for your first shot, a decent vaccine, better vaccine for your second one, and an even better one for your third one. We don't yet know what the best combinations are, but I will bet anyone here that 5 years from now, we won't be using 2 mRNA shots as a standard. That to me is absurd. I think we're going to mix and match to get to higher levels of immunity that are more durable. And the HIV vaccine failures, which have taken place over 30 years' time that I've cataloged, have taught us what the best combinations of vaccines are, because they haven't figured out how to make a working vaccine. And we know that we're not using the best combinations by using 2 of the same of anything.
Paul, thank you for that, John. Paul, looking back at the history of HIV, is there one thing which the world should know about, which would be useful for us to learn? Is there one thing that you think that we should learn from the history of the HIV?
Difficult question, actually. I think overall, I think it has taught many of us to look to ourselves, to have our own responsibilities. And I think, you know, when you talk about vaccines, whether people want to take a vaccine or not, that they need to be instilled with that same idea that they need to look after themselves, to look after other people. I think that's probably the most common thing that I've come across over the years, is that sort of not just self-preservation, it's about protecting other people too, and that's what we need here now.
Okay, we're coming towards the end, and there's a couple of questions that have come in. One from Caleb Richards, and another one also come in, relating to social media but also to business. Are people actually making money out of this at the expense of people's health, in your view, out of the viruses, at the expense of people's? I'll just go to everyone and ask everyone that question, and then we'll have to wrap up. So I'll start with Alwyn. Alwyn, do you think people are making money out of this?
I have no evidence that they are, but I think they probably are, if you know what I mean.
Okay. Apoorva.
Absolutely, yes. And actually, my colleagues at the Times have done a series of stories on people who are really profiting from misinformation campaigns.
And do you think therefore that is actually stopping people, or getting fake news out to people, if we can use that phrase again?
Is that stopping people from getting the right news?
Yes.
Yeah, absolutely. I mean, I think that this is a cottage industry that has grown into a much bigger industry, and it's very smart, very targeted, and it is actually actively preventing people from getting the information they need.
John, do you want to comment on this? John Cohen?
Yeah, no, I agree with what Apoorva said. I mean, the question I thought was a little broader. There is a pharmaceutical industry that's based on capitalism, and yes, big companies are making tremendous amounts of money selling products that they have patents on and that they own intellectual property on. And this has been very divisive, in particular with the technology for the mRNA vaccines that much of the world wants and has had trouble accessing because of intellectual property and failures of companies to help others learn how to use the technology. So yeah, of course, money's all wrapped up and profits all wrapped up. When isn't it in a medical crisis? There is a capitalist system that fosters great new medicines, and that's the argument in favor of it. And it comes at this cost of people making tremendous amounts of money off the backs of a crisis.
Thank you. Erin.
Yeah, I mean, John brings up an interesting point. And I think that is one thing that people who peddle in misinformation are going to point to and say, like, here's this capitalist system, they're making a lot of money, so therefore, you know, they have a financial interest in that. Like, don't pay attention to them, pay attention to what I have. And I think that kind of fosters in this, especially when we're in a crisis and we don't have a lot of information. People say, I have all the answers. And so when there's uncertainty, people say, don't listen to those people who are talking about caveats. I have all the answers. Here's my product. And that is appealing to a lot of people. And they have those people also have a financial interest in it. So that is absolutely happening in our current environment.
Thank you.
Yeah, and just
over to you,
very quickly on one thing Erin said. The ivermectin hydroxychloroquine push is coming, as the New York Times reporters have documented, from people who are making money off of pushing this stuff. So it is connected. And I think you're exactly right, Erin, that they tarnish big pharma or whatever in order to make money themselves.
Yeah, mountebanks in Shakespearean's day, we'd call them. Paul, your view?
Well, very much the same as the others, I think. I think one really unfortunate thing in this country, and I presume it must have happened in other countries, is ministers from our government who have favoured certain pharmaceutical companies or manufacturing companies during this, allegedly. And that type of action, of course, really does feed into the conspiracies about why people shouldn't take a particular virus or protect themselves in that way. So yes, of course, money's everywhere in this virus in a way that I don't see or haven't seen it or had it reported to me in the history of HIV in the way past, although there was a lot of controversy around the cost of drugs at that time and who was making money and why they were being sold at exorbitant amounts. So again, it's reflected back through history.
Yes, and of course, it's not just in terms of individuals, it's in terms of the richer nations and the poorer nations. But we haven't had time to go into that either today, but we just mention it at the end because it's a significant issue. related to the whole of the world, because until we control it across the whole of the world, we're not controlling it at all. And as the richer nations, we need to have a responsibility about that. Sandy, over to you. Are there any final questions you want to ask or points you want to make before I wind up? And we've gone over time. I hope you'll forgive us.
Yes, I think we've covered an awful lot, Mike. So I'm not going to keep everybody. We start to have people drifting away. I think we've had a wonderful discussion. I appreciate very much the 5 people who gave their time and their expertise and their wit and their wisdom to this conversation. Thankful to you, Mike, and our continuing collaboration, and to people at Georgetown University, including President Jack DeGioia, who's encouraged us along this path. John McCabe, our relatively new administrator of all things in Washington, has done a wonderful job to keep these programs going. I do want to mention one coming up from the Free Speech Project itself on February 28th, 2 weeks from today, tentatively titled something like, how does our growth of knowledge these days, very much related to what we're talking about today, how does our growth of knowledge these days rely on facts, rumors, or bogus theories? And we have some very interesting people talking about the surging distrust, at least in the United States, of expertise, and some quite good panelists. That's Monday, February 28th, 2 p.m. Eastern time. And we'll be sending more information out about that and our stellar panelists on that occasion. For those of you interested in the Free Speech Project and our ongoing work, our website is Free Speech Project, all one word, .georgetown.edu, freespeechproject.georgetown.edu. Thanks for joining us today. Over back to you, Mike.
Okay, thanks. Well, my thanks to Paul, Alwyn, Erin, Purva, and of course to you, Sandy. And likewise, I thank colleagues at Georgetown, including Tom Banchoff, the Vice President of Global Affairs. At Blackfriars, thanks to John O'Connor, the Regent, Richard Finn, the Director of Las Casas Institute, the Campion Hall, to Nick Austin, the Master of the Hall, and Sarah Gray and Ying Ying, Campion Hall administrators. My thanks too to John McCabe and colleagues at Georgetown who made this Zoom event happen. I'd like to thank everybody who's asked questions. I'm very grateful to you for that. If they weren't answered today, because of time constraints, we will endeavour to email answers to you. The next Free Speech Project at the Crossroads International Dialogues event, in association with the Future of Humanities Project, will be on Monday, the 21st of March, 2022 at 11 a.m. EST. But please note, in the UK, that is 3 p.m. GMT for that week, because the clocks will have gone forward in the United States, but they won't have gone forward in the UK until the weekend afterwards. So on the 21st of March, 11 a.m. EST, but in UK, it'll be 3 p.m. GMT before we go on to British Summertime, BST. And at that one, we will be discussing issues relating to veterans, a very important subject, as we all know. There are 2 further events which you might like to know. Tomorrow, 15th of February, 11 a.m. EST, 4 p.m. GMT, Hester Jones from Bristol University will be talking about the writer David Jones, the writer and painter actually, David Jones, in the Christian Literary Imagination series. The next event in the China series will be on this Friday coming, Friday the 18th of February at 11 a.m. EST and 4 p.m. GMT, when Professor Zhudong Zhang from New York University will be discussing the Chinese early 20th century writer Luxun. So please join us for those events. You'll be very welcome. Thank you all for attending today and for all your support for our various activities. I'm Professor Mike Scott, Fellow and Senior Dean at Blackfriars Hall, Oxford. You can follow me on Twitter at Mike Scott Prof. Until next time, take care, keep safe, avoid Omicron, and goodbye. Thank you all very much. Bye-bye.